So the phase 2 study was an investigator-initiated study performed by Dr. Sheldon Jordan at the Regenesis Project in California. He performed the study, and the sponsor was BioVie, who provided the drug for the study. We helped after the study was completed with some of the analysis. So the phase 2 study was an approximately 25 patient open label study looking at patients with MCI and mild dementia. The patients were studied with the drug over the course of 3 months. The patients received the drug twice a day and had a number of procedures successfully conducted during the study. These included the typical neuropsychological, neuropsychiatric batteries, such as the ADAS-Cog 12, but also performed were a number of other CSF and blood biomarkers, as well as neuroimaging. Ultimately, over the course of 3 months, we saw that the patient showed improvement, that they improved on the ADAS-Cog, rather the ADCOMs and the COG 12. And those improvements from baseline were accompanied by improvements in inflammatory biomarkers and improvements in functional connectivity done on brain scans. So overall, in this open label study, we saw that the drug performed as we had expected it to. We had the target engagement in the way that we expected, and we mean that inflammatory biomarkers improved as expected. We expected there to be an effect on glutathione. We measured that with MRS in the brain and the precuneus. We saw that glutathione levels improved, and that glutathione levels also were correlated with both functional and biological improvement. And this was the same study. The multimodal correlations were presented in addition to the clinical outcomes. So reviewing in the clinical work, we saw multiple positive findings in this short study. The multimodal correlational studies were there, as I had just described, to show that the clinical findings, neuropsychological findings, were nicely correlated with improvements in functional connectivity, reduction in the burden of inflammatory cytokines, reductions in TNF-alpha. We were also able to show in that poster that there were other changes that patients experienced that were also noted by their families. So we saw that the majority of patients reported improvement. That improvement was also reported by family members in our exit interviews. We have a program moving forward right now. That program in mild to moderate dementia is being conducted in the United States. There will be approximately 400 patients in that study. That study is fully enrolled right now. We expect readout towards the end of the year, and that will tell us something more about the activity of the drug in mild to moderate dementia. We're also starting programs this year in Parkinson's, and we're also studying additional studies this year in mild cognitive impairment.